The Gauteng government is looking to boost the provincial vaccination drive. Today, Premier David Makhura, Health MEC Dr. Nomamthemba, Mokgethi and Johannesburg Mayor Jolidee Matongo are visiting vaccination sites in the city of Johannesburg. Let's get more on this with our reporter Mbalenhle Mthethwa in Lawley, south of Johannesburg. Very good afternoon to Mbalenhle. We're hearing that men in particular are not taking up the vaccine as fast as they should. Tell us what's happening where you are.
You're absolutely right, Nzinga. It seems as though vaccine hesitancy is actually out at play where we are in Lawley. We understand that our Gauteng Premier, together with his cabinet, are actually at this community, visiting this community, making door-to-door visits and trying to convince people to come out and get vaccinated. You would have seen just not so long ago a mobile vaccination station just in front of me, and it seems as though since we know that we started as early as 10 a.m. this morning visiting other vaccine stations, but we recently just started with the door-to-door campaign, speaking to people, and so far we've only had 2 people getting vaccinated. We understand that those people are being vaccinated right now as we speak, but I'm not alone. I am joined by our Gauteng Premier David Makhura. Thank you so much for speaking to us, David, Premier. The province has set targets to vaccinate a certain number of people come December. What are the chances of meeting this target, given what we've seen here with regards to vaccine hesitancy?
Well, firstly, let me say that we have done 2.3 million vaccinations so far. Just 1 million vaccinations in Johannesburg in the last, we reached that 1 million in the last 24 hours. That is a very good sign, but we still have a very long way to go. We have 11 million adults, that is 18-year-olds and above in Gauteng. We want to reach as many people as we possibly can, especially ahead of Christmas and ahead of the possible 4th wave. The critical thing now is really to get the vaccines to the people. So far, we had at the pop-up site here in Lawley. It's going extremely well at the site, at the fire station there. But we decided that often we need to do what our mobilization teams do. The mobilization teams in the province do door-to-door work. They go street by street. They've been giving us feedback that in some areas they are picking up hesitancy, and I came face-to-face with that today, that there are indeed people who are reluctant. We check what the issue of concern is to them, but a lot of them have had lots of stories about vaccines and they are concerned about safety. But I have been assuring people here in Lawley and everywhere across the province that the evidence we have seen from our healthcare workers and the evidence from all over the world is that these vaccines are working. We have had a huge problem of healthcare workers who were sick during the first wave, who had to be released, some admitted in hospital, and some of them passed on. But those who were vaccinated just during the 3rd wave, we saw that we had much fewer healthcare workers admitted in hospital and sick. So what does this mean? It means vaccines do minimize the chances of getting severe disease. They also drastically reduce the possibility of people succumbing to COVID. All the stories people hear, we come face to face with them. We are here to reassure members of our communities that the greatest risk is to go to Christmas without vaccinating, and the greatest risk is particularly amongst the elderly. But we also want, we are getting lots of those who are between 18 and 34 saying that they are ready, they want to take their vaccines now. So that message has gotten to our national government. So we are going door to door now, and we come face to face with those who have an explanation to give why they have not vaccinated, but those who are ready, we also vaccinate them immediately.
During the briefing, you came up with a suggestion because some of the major issues that have come up is that mostly male South Africans are reluctant to vaccinate, and there was a suggestion that you came up with during the briefing. Talk to our viewers about how you, as the province, would like to encourage South Africans to get vaccinated.
Yeah, so one of the important things is that so vaccinating is good for the family. Family members need to know that if you have one member of the family, especially the elderly who are not vaccinated, is a great risk. But we want to encourage family members to be able to say whoever is not vaccinated in the family is a risk to the family. But we also want to encourage young people and sports people to say that we are looking at incentivizing those who are vaccinated. And I've been saying that one of the greatest things we would really want to explore is to say now that in Gauteng province the numbers have been going down because we want to lift the vaccinations. We also want to look at opportunities to be able to open some of the sports activities where only the vaccinated people will be able to go, because we have seen it all over the world. When there are more people vaccinated, we can go and watch a Kaizer Chiefs Orlando Pirates game at FNB Stadium. So we want to encourage, we are looking into very different ways of encouraging people to vaccinate. We know we can't force people to vaccinate. In this country, you know, each people have their own human rights, but I also want to say we must think about the risk we pose when we are not vaccinated, the risk we pose to other people, and I really want to ensure that in my family all those who qualify are vaccinated. Because then when all of us are vaccinated, those of us who are 18-year-old and above, it is safer for the family. Let's do it at family level. Let's do it at community level. Let's do it at the street level. And then we can help also open up a lot more. I would also even say in the churches, when we have we are working with the religious leaders now in the various faith, communities of faith, to also use the churches, the mosques, the temples as vaccination sites as well, but to also get the religious leaders to get the message across that if you are a member of a particular church and then there are more people in that church who are vaccinated, it also enables the church to be able to function normally. We are doing that with the workplaces, with various sectors, to make sure that we are not saying people must be forced, but we want to incentivize people to be able to vaccinate. And we are still thinking about the younger generation. We're talking with some of the businesses on how to incentivize, but also disincentivize. As I say, in my family, if you are not vaccinated, you can't join us for lunch. You are a real risk.
But Premier, I'm so sorry. But doesn't that take away the choice, you know, of vaccinating? Because if there are certain places that non-vaccinated people cannot go to, like you made mention of a whole soccer field filled with people who are only vaccinated, doesn't that not take away the choice not to vaccinate?
Yeah, certainly choice is something that is an important issue, but think of the pandemic. The burden is not just on individuals. The burden is on communities. The burden is on households. The burden is on a nation. When you have more people who are sick, you have more people who need to be admitted into our health system, and we have lost many people. You have people traumatized. I haven't seen in my life so many family members and friends losing loved ones. I haven't seen it in my lifetime. What does that do to communities? You have lots of distress in our communities. In addition, People have lost jobs as a result of COVID-19 pandemic. And then the increasing levels of poverty. There's also increasing levels of violence against women and children. If you take all those kind of things together, yes, people have a choice. But don't think selfishly just about yourself. Think about your family, the risk you pose to your family and the risk you pose to the community. So make the choice, but it must be a wise choice.
Okay. There we have it. Gauteng Premier David Makhura speaking to us about the choice that South Africans have to get vaccinated. He is with his cabinet here in this community, going door to door, trying to convince people to try and get vaccinated.